So in 2020, the research focused on the theme of cannabis for medical purposes. And after a year worth of research, the recent discoveries of the potential that CBD, which is a substance extracted from cannabis, has for treating neurological diseases, the theme was changed in 2021 to cannabidiol specifically as a treatment for neurological diseases. The general aim of this work is to comprehend and investigate the use of CBD as a treatment for neurological diseases, focusing on the social historical context of this use, presenting actual documentation and documents of this use, as well as understanding the legal situation of cannabis in Brazil as well as in other countries of the world. These objectives were attended through three different subtopics. The first subtopic talked mostly about the social historical context of the use, and it was concluded that there are three main theories regarding the origin of it. And the first claims it was in Pers, which today is Pakistan, Afghanistan, and Iran. The other one says it was in India in the Vedic era, which is around 1,000 years before Christ. And then 2,300 years before Christ, there is the theory that it started in China. And this in fact was confirmed because there was this emperor in China that would make use of the therapeutic properties of cannabis to treat rheumatism, constipation, and menstrual problems. And starting from there, it was possible to trace a long historical course of this use until nowadays, when in most countries of the world, the laws are very rigid and strict regarding cannabis. However, there are still countries that tolerate it. For example, the Netherlands. In the Netherlands, the selling and the consumption is completely legal. That there are even these stores they call coffee shops where you can buy cannabis. And for instance, in Portugal, the consumption is tolerated, but the trafficking is not. And lastly, in Brazil, recently in 2015, Anvisa removed CBD from the list of illicit substances, and therefore is nowadays legal. And then in the second subtopic, it was mostly about the different species, subtypes, and chemical compounds in cannabis. And it was possible to conclude that there are three main species of cannabis. There is cannabis indica, cannabis sativa, and cannabis ruderalis. Cannabis sativa is in focus when talking about medical purposes because it is related to the stimulus of the mind. And inside cannabis sativa, there are still dozens of subtypes. The most known are hemp and marijuana. And they are very different. However, there is one thing they have in common, which is the chemical structure. This chemical structure contains 420 chemical compounds, which are called cannabinoids. And among these cannabinoids, there are three main types of it, which are tetrahydrocannabinol, also known as THC, cannabinol, also known as CBN, and cannabidiol, which is the focus of this study. And the main difference between these chemical compounds is the psychoactive effect. The psychoactive effect is what alters the way of thinking and acting and speaking and what gives the euphoric sensation. While THC and CBN contain this effect in very high levels, CBD also does, but in very low levels, in levels that are unnoticeable. And that is why CBD is in focus when talking about the treatment for neurological diseases. There's also another factor, which is that THC and CBN, they can damage the cognitive functions of a person, while CBD makes them even better. And CBD is usually extracted from the subtype that is called hemp, and because it has very low levels of THC, while it has also high levels of CBD. And then in the third subtopic was about documentation and results of the experiments regarding this use, and it was able to conclude that for epilepsy, schizophrenia, and anxiety, CBD has very positive results, however, almost always accompanied by negative results too, which are the side effects. They contain diarrhea, weight loss, and alters in the blood pressure, and that is really negative. Therefore, there is still the necessity and need for more studies regarding CBD as a treatment for neurological diseases, because there is still the need to achieve the safe use of it. To do that, society needs to integrate itself more in this context and disconnect from the myths that cannabis only has recreational purposes, because its therapeutic properties are very relevant and evident. Thank you.